The United Kingdom is under national lockdown tonight as a highly contagious mutation of COVID-19 has hospitals there buckling under the strain of new patients. Daniel Hewitt of Independent Television News has our report.
On the first full day of this third lockdown, even some semblance of normality feels right now a distant hope. A few are making the most of what small freedoms remain as the Prime Minister revealed a big jump in the number of people with coronavirus.
People understand overwhelmingly that we have no choice. When the Office of National Statistics is telling us that more than 2% of the population is now infected, that's over 1 million people in England.
A number so alarming, the Chief Medical Officer felt it worth repeating in more stark terms.
Across the country as a whole, roughly 1 in 50 people have got the virus.
Getting that number down means at least another 6 weeks in lockdown, as the PM repeated that the route out remains with the vaccine.
As of this afternoon, we've now vaccinated over 1.1 million people in England and over 1.3 million across the UK, and that includes more than 650,000 people over 80.
But even with all of the most vulnerable vaccinated, there came this warning that even 2021 may not be the end of restrictions on our lives.
Things we lifted stage by stage, and will then get over time to a point where people say this level of risk is one that society is prepared to tolerate, and lift, right down to almost no restrictions at all. We might have to bring a few in the next winter, for example. That is possible, because winter will benefit the virus.
Next winter may feel like a lifetime away. The near-empty streets of Exeter tonight speak of a city and a country trying its best to get through this one.
Back here in the U.S., the virus's spread is particularly bad in Southern California. Nearly 1 of every 5 people tested in Los Angeles County is positive. A record 74,000 plus new cases were recorded in the state yesterday, and the death toll for just one day is nearing 400. Because of this, hospitals are running short of crucial supplies like oxygen. We're joined again by Dr. Christina Gali. She's the Director of Health Services for Los Angeles County. Dr. Gali, very good to have you back on the NewsHour. The last time we spoke to you was Christmas Day, and you said at the time that hospitals were nearing capacity back then. It sounds like it's gotten a lot worse even since then. Can you just give us a sense of what's happened in the last 10 days or so?
Sure, thanks for having me. The past 10 days, we've consistently seen hospitals add on average of about 200 patients a day across the distribution of Los Angeles County, and hospitalizations overall in the county are at 8,000. That means that just over half of our hospital beds that are filled with patients are filled with patients with COVID, and 3/4 or more of the intensive care unit, the ICU beds that take care of those who are most critically ill, are filled with COVID patients. This is stretching staff, stretching the supplies, stretching the emergency medical services system to a point that is causing both a lot of strain and pushing staff to the brink of exhaustion, but also is obviously something that's really not sustainable and doesn't lead to the conditions where we can provide outstanding patient care for each and every person who needs hospital level care, both those with COVID and those without.
And I know there's an effort to discharge as many patients as you can as safely as possible, but given your case numbers, I imagine the minute you empty a bed, that gets filled almost immediately.
Yes, it does, often several times over. Right now, we're admitting more patients with COVID than we're able to discharge. So about 700 patients a day come in with COVID, but only 500 patients a day are able to be discharged. We are working to discharge patients just as quickly as hospitals can, but the entire health system, not just hospitals, are experiencing strain and stress, and in particular staffing shortages. So that affects all of the lower levels of care. It affects long-term acute, subacute facilities, skilled nursing facilities, and it's making it very hard to move patients through the continuum of care. What we need to do, though, is move them efficiently. We need to save those very precious acute hospital resources for the patients that need them most.
We know that the vaccine rollout has been sort of erratic across the country. And I know that in California, I think you vaccinated about 1% of the population. We've also been hearing reports about staff at nursing home and even healthcare facilities who themselves are reluctant to take the vaccine. Have you been hearing that? And if so, what's your sense of what's driving that reluctance?
I think there's a number of things. I mean, first, I think it's important to remember that this is a provisionally approved vaccine. It has been shown to be safe, it has been shown to be effective. I think there was a rigorous process to demonstrate both its safety and effectiveness, but it's still just a provisional approval. And that may make some people nervous. And I hope they look to the data, they look to the safety data and realize that it's safe. But many people understandably have some anxiety about that and don't necessarily want to be the first to get the vaccine. Within our health system and the 4 public hospitals and clinics that we operate, we've seen good uptake of the vaccine around the order of 75 to 80%, which is at the high end of, I think, what we're experiencing across California. But that still means that 20 or 25% of healthcare providers are taking another minute and deciding that at this point they don't want to receive it. We're still continuing to message with them and encourage them to get the vaccine, and we'll keep that effort going, and we hope to improve the uptake rate in the future. But there's understandably a lot of anxiety.
We've also just seen that the UK is going under this incredible lockdown because of the incredible surge of cases with this new variant. How concerned are you that that is a real driver of all the cases you're seeing in Los Angeles?
It's certainly possible. There's been several cases that have been detected in Southern California. And while the public health officials haven't yet captured or identified that particular variant in the samples they've tested from Los Angeles County, they're testing only a very small fraction of the total positive case counts. And I think it would just be really hard to believe that that variant isn't out there. Now, how much that variant versus the other ones are contributing to the very high case counts, we just don't know at this point. But whichever variant it is, I think the message is still the same, that the virus is virtually everywhere in Los Angeles County right now. 1%, if not more, of individuals are infected and infectious and potentially actively infecting others. And everyone needs to do everything they can to protect themselves and to protect others, and should always assume that everyone they're interacting with might have COVID.
All right, Dr. Christina Gali, Health Services Director for Los Angeles County. Thank you very much and good luck out there.
Thanks very much.